Hello everyone, I'm Arthur, CEO and co-founder of codoc with Nicolas. Codoc is a health tech company specialized in healthcare data warehouses and applications for better research and better care. Today we are going to focus on one particular use case of the platform. And before we jump right into the subject, to tell you about the company story, we met with Nicolas in 2017, and Nicolas was from Imagine Institute of Rare Diseases and managed to really democratize the use of healthcare data produced during care for clinical usage. So that was really a hit among care researchers. And so we created codoc to give more impact to these technologies and ultimately connect our healthcare providers together to form learning health system that improve every day based on real world data. And so today we work with certain hospitals, and we have and also pharma companies, medtech companies, and we have developed in many hospitals in France. And so the more hospitals we can embark on these systems, the more impactful the technologies we developed will be. And one of the applications that were the most impactful in the short run and that we're going to present to you today is how we can accelerate rare disease diagnosis thanks to data produced during care.
Just to have a little focus on rare disease, because it's not obvious for everyone. Rare disease, it's one disease is considered as rare if there is fewer than one in 2,000 patients. It affects one in 2,000 patients. But rare disease, there are a lot of rare disease. Up to date, 7,000 are well known by the researchers, but not so well known by the physician. This is why it's not easy to be diagnosed with a rare disease, especially if the disease is not well known by the physician and if the signs are not pathognomonic for this disease. So we have 350 million of people in the world with a rare disease today, and we are talking about the diagnostic wandering, the time during you are not diagnosed but you have the signs of the disease. And the average is, it moved a lot, but let's say 5 years between the first signs of the disease and when you have the right diagnosis. And in between, you have a lot of exams and visits to the specialists and misdiagnosed and wrong treatment, etc., etc. So it's a big issue, and it's considered as a very public health things to solve. So this is why we developed an application based on the data warehouse of the hospital. So the idea, we have the data warehouse with all the data, especially all the health reports written by the physician. And we developed an algorithm which compared an archetypal patient for a specific disease with all the signs defined by the physician, the experts, and the literature. And we compare these patients with all the patients of the hospital by using the data warehouse, and we are able to screen all the patients and to detect the most similar patients, and maybe in this one there is 1 or 2 or 10 patients with the rare disease. We already published, we are working on this for 6 years now, and we are already published methodologies that I won't explain right now. But we also published a success story just to show that we have the method, but it works in the real life. So we already diagnosed patients with, in this example, it was in Necker Hospital on epilepsy, rare epilepsy, a mutation on the gene KCNA2. And we already had 2 diagnosed patients with all the phenotypes, the clinical sign of these patients, and we are able to diagnose this 3rd patient, the patient A, and we can see in this that it is very similar to the other one. But we find this one in 1 million patients in the data warehouse. And I let Arthur continue.
So what's interesting is that we actually, this is one use case, but it works with other rare diseases that we are currently developing, and there's a huge synergy with healthcare data warehouses that are developing currently in hospitals. So the idea then is to scale those systems, because of course every hospital actually, when you look into an average hospital in France, it has, if you make the effort of bringing in maybe 10 years of data, between 300,000 and 600,000 patient records. So you can actually, you have a chance to get a hit and find a patient that's in diagnosis wandering and that has been maybe misoriented in his healthcare path. So that's what we are currently doing with codoc on a couple of projects, try and scale and deploy this algorithm in real lives on healthcare data warehouses that are currently being set up in hospitals. So French government invested 75 million euros last year that are currently being deployed. So every hospital in the country benefits from these technologies. So this is coming, and we are building those roads to accelerate time to diagnosis for those patients. That's it, actually. We are looking for, of course, for partners to work on these rare diseases, because there are so many of them. There are more and more personalized care paths for many diseases. So we are looking for, of course, healthcare providers willing to deploy those technologies. We're looking for research institutes, researchers, and pharma companies, everyone willing to really tackle this challenge of diagnostic wandering with us. And happy to take any question.